Hello friends, I am Dr. Sadeep. Welcome all to our channel DEMOMEDICO-DIVINE Master. In the previous session, I have discussed about the germ layers, friends. That is ectoderm, endoderm and mesoderm. From which layer, which organ is formed and which group of cells form the which tissues and organs. Today what we will discuss is how the disease layers are formed in the human beings. So these disease layers are formed because of this germ layers. So disease will suppress and it will go on proliferating in the germ layers, first in ectoderm, then in endoderm, then in mesoderm. So this is about the proliferation of the disease according to homeopathy. So one layer, that is ectoderm, give rise to two miasms. So each germ layer give rise to some miasms. I will be explaining in detail in this session, friends. So there are 3 germ layers and there are 7 layers of diseases, as I told you. So I will be putting in the sidewise or in the this one caption what are the germ layers and what are the miasms affected. So you must understand the miasm in total to come to a conclusion what is the course of the treatment or how the treatment will progress in a patient. In a chronic patient, we will usually come to a totality of the symptoms, but until and unless we will be having the miasmatic totality, the patient will not improve to the extent what he is expected or what we will be expecting to cure the disease. So this is very important in diagnosis. There are 3 types of diagnosis in homeopathy. So one is totality of the symptoms, one, and miasmatic background is very necessary if you want to cure the patient. And another is the pace of the disease. If these 3 are matched in a patient, so the patient will recover very fast. So coming to this layer, disease layer, friends. So first, if you consider Psora is the dominating miasm in few of the patients. If the Psora is dominating miasm, what are the organs affected? This is the first layer. So second layer is Psoro-psychotic. So psoric miasm will be there and psychotic miasm. Together they will be affecting the body. Then it will be a second layer. So third layer will be purely psychotic. So whenever the patient is having a dominating miasm as psychotic, then these will be the organs affected. After that, psychosyphilitic. So psychosyphilitic means psychotic features will be there and syphilitic features will be there. So when you come to this psychosyphilitic layer, these are the organs will be affected. Then is syphilitic with Psora, that is tubercular miasm. Tubercular miasm affects these type of organs. Then purely syphilis, only destruction of cells or purely a syphilitic miasm will be taking care. Lastly, the miasmatic background will be cancerous. All 3 miasms will be dominating in the same quantity. That is, Psora will be there, sycosis will be there and syphilis will be there. So if all the 3 miasms are dominating in a patient, then it is called as cancerous miasm. So this is the miasm and layer theory of diseases, friends. I think you understood what I want to tell you today. So in detail, we will go one by one. Psora. So as you know that Psora is a functional disorders of the organs. Here basically the tendency of the organs which will be affected are like this, friends. So in Psora, majorly the ectoderm is involved. So there will be a skin involvement and cornea, conjunctiva, lips, palate, ears, sweat glands and parotid. These are the organs involved in the first layer, Psora. So first layer we will be coming across all these organs affected, friends. So next we will go to second layer. In second layer, what are the organs affected and which is the germ layer which will be involved. So in the second layer, the germ layer involved is endoderm. So in this endoderm, basically the organs or the cells involved is upper respiratory tract, liver cells, gastrointestinal tract, gastrourinary tract and bile duct. These are the organs involved in the second layer of disease, friends. Third layer, if you consider what are the organs involved, we will see to it, friends. In third layer, mesoderm connective tissue is the third layer of germ layer. In this layer, bones, joints, muscles, cartilage and dermis. These are the organs. These are the organs affected in the third layer of diseases, friends. Fourth layer, if you go into the fourth layer, germ layer, is organs of mesoderm. So these are the organs which are involved in the disease, friends. Fourth layer of disease, I mean to say. CVS system, that is heart and blood vessels, kidney parenchyma, lungs parenchyma, blood and lymphatic system. These are the organs involved in the fourth layer of disease, friends. Fifth layer, if you go into, so fifth layer is the endocrine system. In this endocrine system, the organs involved is pancreas, thyroid, adrenaline and testis, ovaries. These are the organs involved in the fifth layer of disease. This is purely a endocrinal layer, fifth layer. So sixth layer, if you go into sixth layer, if you consider, there will be a neural plate damage, that is central nervous system and sensory nervous system. So here in the sixth layer, there will be a nervous system damage. Due to that reason, neural plate manifestations are major, friends. And finally, in the seventh layer, so what is affected is the changes in the genetic code. Changes in the genetic code of the individual cells is occurring in the seventh layer. This we will call as AIDS, acquired immunodeficiency syndrome, or it can be called as cancer. It is the end stage of disease in our homeopathic layer wise, if you consider the disease, friends. This is all today, friends. So I have made you understand how the germ layer are formed, what are the germ layers involved in the diseases, how the disease proliferates from the basic skin level to the highest cancerous level. So today, this is all today, friends. I think you enjoyed this session. If you really like this video, please share to your doctor friends and your medico colleagues and all. So this will be a very helpful in their practice and understanding the homeopathic basics. If you understand the basics of homeopathy, that is germ layers, miasmatic diagnosis and the totality of the symptoms, it will be very easy and helpful in the curing of the patient. So prognosis also can be done on this germ layer. So when you start applying the proper anti-miasmatic drug, the medicine will cure the layer that will come to a superficial layer, so that we are going in a proper direction. This can be understood, friends. So this is all today's session, friends. Thank you one and all. Take care.